So my name is Jason Eberl, and I direct the Albert Nagy Center for Healthcare Ethics at St. Louis University. And I'm very proud today on behalf of the Nagy Center faculty, staff, and students to be sponsoring this plenary talk by Dr. Matthew Liao. Before I get to his biography, let me tell you a little bit about our center. The Nagy Center is one of the oldest bioethics centers in the US, having been established in 1979, initially to provide ethics education for St. Louis University's School of Medicine students and clinical ethics consultation for SLU's 2 hospitals. Since then, the center's reach has kind of grown until we're basically in almost every school or college and university. We teach courses in public health ethics, nursing ethics, dental ethics. We teach all sorts of pre-health profession sciences students, and of course, we still continue to teach the medical students. In 1996, the center launched a PhD in healthcare ethics. So there's the advertisement. If you have bright undergrads or master's students, maybe looking to do a doctorate in bioethics, come see me. And we offer joint or combined degrees with law, medicine, philosophy, and theology. St. Louis University is a Catholic Jesuit school, and so while we don't exclusively do Catholic bioethics, that is one of our specialties. The center's faculty, we also have an undergraduate major and minor in bioethics and health studies. The center's faculty comprises diverse expertise in palliative medicine, pediatrics, research ethics, philosophy, theology, social work, public health, disability studies, and other interdisciplinary fields. So again, it is my pleasure to welcome Dr. Matthew Liao today to APPE. Just learned it's his first time at APPE, so hopefully not his last. Welcome. Dr. Liao is the Arthur Zittrain Chair of Bioethics, Director of the Center for Bioethics, Professor of Global Public Health, and affiliated professor in the Department of Philosophy at New York University. He's the author or editor of The Right to be Loved, Ethics of Artificial Intelligence, Moral Brains, The Neuroscience of Morality, and the Philosophical Foundations of Human Rights, all with Oxford University Press. I've heard of them. As well as Current Controversies in Bioethics with Routledge, and over 70 articles in philosophy and bioethics. He's given TED and TEDx talks in New York and CERN, Switzerland, and has been featured in the New York Times, The Atlantic, The Guardian, the BBC, Scientific American, and other media outlets. He is the editor-in-chief of the Journal of Moral Philosophy, a peer-reviewed international journal of moral, political, and legal philosophy. Dr. Liao has previously served as the Deputy Director and James Martin Senior Research Fellow in the program on the ethics of the new biosciences in the Faculty of Philosophy at Oxford University. He's also been the Harold T. Shapiro Research Fellow in the University Center for Human Values at Princeton, a Greenwald Research Fellow at Johns Hopkins University, and a visiting research at the Kennedy Institute of Ethics at Georgetown University. Are you kind of settled in NYU now? I'm going to stay there for a while. Okay. Dr. Liao obtained his doctorate in philosophy from Oxford University and his AB from Princeton. Today, he'll be speaking to us on the ethics of AI and healthcare towards a substantive human rights framework. Please join me in welcoming Dr. Matthew Liao.
Can everybody hear me? Great. Thank you, Jason, so much for that warm welcome. And hello, everybody. So actually, I'm from Cincinnati, and it's really nice to be back. I got to see my parents for the first time in 2 years, and as well as my 97-year-old grandmother. So that was really nice. Anyways, it's a great honor to be here. So there's enormous interest in using artificial intelligence in healthcare contexts. AI applications have begun to diagnose cancer better than doctors, identify heart rhythm abnormalities like cardiologists, diagnose various eye diseases as well as ophthalmologists, and identify viable embryos as well as fertility specialists too. But before AI can be used in clinical settings, we need to make sure that AI researchers follow appropriate ethical guidelines and frameworks when developing these technologies. And in recent years, there have been a great number of ethical frameworks that have been proposed. So to date, there are over 80 such frameworks from private companies, government agencies, and so on and so forth. Now, these frameworks have some recommendations in common. So for instance, many draw on the 4 principles of biomedical ethics: beneficence, autonomy, non-maleficence, and justice. Among other things, autonomy, for example, seeks to ensure that patients and consumers are fully informed and understand the risks and benefits of particular health technologies and voluntarily consent to it. Beneficence aims to guarantee that AI health applications promote the well-being of patients and that of society as a whole. Non-maleficence strives to ensure that health AI technologies do not impose undue harm on other patients. And justice seeks to promote the fair and equitable distribution of benefits and burdens of AI health technologies. And in addition to these four principles, many frameworks also list such recommendations as transparency, explicability, and trust, given that some forms of AI are not understood easily, if at all, even by those who program them. And I'm going to come back to this point shortly. Now, at the same time, many of these frameworks and organizations also offer their own distinct recommendations. So here's an example from the Future of Life Institute, and it lists something called value alignment, and which says that highly autonomous AI systems should be designed so that their goals and behaviors are aligned with human values. Here's another one from Microsoft. It recommends inclusiveness. And that says that AI systems should empower everyone and engage everybody. Now, in one sense, it's really great that these organizations were concerned enough about ethics to put forward these frameworks and guidelines. But in another sense, however, this proliferation of ethical frameworks has created a bit of a lot of confusion from which pressing questions arise. How were these particular sets of recommendations developed and not others? Which recommendations should AI developers and organizations follow, and why? More fundamentally, what grounds and justifies these recommendations? How do we distinguish between recommendations that are genuine from those that are not? And furthermore, how does one use these recommendations in practice? So for instance, it seems reasonable that we should not impose harm on patients, but how do we achieve this? Likewise, it seems that we should be able to trust an AI system, but how do we decide which AI systems to trust? Now, unfortunately, most of these AI ethics frameworks have been silent on these questions. And as a result, they've been criticized for offering abstract, high-level principles that in practice have provided few concrete guidance. And moreover, some people have expressed the concern that these frameworks are merely forms of ethics washing and virtue signaling, where organizations are companies are just exaggerating their interest in ethics as a public relations exercise, and maybe to forestall governmental regulation. So to stave off such accusations, we therefore need an AI ethics framework that is grounded in substantive normative theory, and one that can help us assess whether a recommendation is genuine or not. As Jason mentioned, elsewhere, I've done a lot of work on human rights, and I've developed something that I call the fundamental conditions approach to human rights. And that basically says that human beings have human rights to the fundamental conditions for pursuing a good life. And I have applied this framework to a bunch of issues in bioethics, as well as research ethics. And so in this talk, what I'm going to suggest is that the fundamental conditions approach can be extended to the use of AI in healthcare. I'm going to illustrate how this approach can help us evaluate the merits of a given recommendation. And I'm also going to show how companies and AI researchers can identify distinct ethical considerations through this framework. So to develop this framework, let me first say something about what AI is and how current forms of AI can give rise to ethical problems. So there's no agreed upon definition of AI. For our purpose today, we can understand AI broadly as getting machines to do things that when intelligent beings such as humans do them, require cognitive functions such as thinking, learning, and problem solving. And AI can take many forms. One form is something called symbolic AI, which uses a series of if-then statements to establish the relationship between inputs and outputs. Another form of AI is machine learning, and which uses algorithms to learn from data without being explicitly programmed to do so. And within machine learning, one can distinguish between supervised learning, unsupervised learning, and reinforcement learning. So supervised learning is where an algorithm is trained on a data set, in which the correct answers for certain data are known, and then the data are labeled accordingly. And once you've trained, once the algorithm learns the relationship between the outputs and the inputs, it can then apply what it has learned to some new data set. In unsupervised learning, a given data set hasn't learned the relationship between inputs and outputs, but it aims to do so on its own. In something called reinforcement learning, a reinforcement learning agent attempts to learn through experience. The algorithm rewards this agent if it succeeds, and punishes the agent if it fails. And basically through trial and error, the agent strives to maximize the long-term reward. And all these methods can be combined with something called deep learning, which uses different layers of nodes to detect increasingly abstract features, which maximize information capture while minimizing losses in predictive accuracy. So as impressive as machine learning is, it also suffers from certain limitations, which can give rise to a host of ethical issues. So for example, machine learning needs a lot of data to work well. Supervised learning algorithms can fine-tune themselves when they have a lot of data. So consequently, this incentivizes companies and organizations to harvest or buy data, including sensitive personal data, even when doing so might violate an individual's right to privacy. So one example of this is when the Royal Free NHS Foundation Trust gave the personal data of about 1.6 million patients to Google DeepMind in 2017 in order to figure out a way of testing kidney injuries. But they didn't tell the patients how their data was going to be used. Another case is when the drug maker GlaxoSmithKline bought the exclusive rights of to mine the genetic data of customers of 23andMe's. That's a DNA testing service. Secondly, machine learning is only as good as the data from which it learns. If an algorithm is trained on inadequate or inaccurate data, then it's going to make bad predictions, even if itself is designed well. So this is known as the garbage in, garbage out problem. So for instance, algorithms trained on gender imbalanced medical imaging data sets have been found to do worse at reading chest x-rays for an underrepresented gender. Similarly, there are reasons to be concerned that skin cancer detection algorithms may not do as well detecting skin cancer affecting people with darker skin, because many of the algorithms are trained primarily on lighter skinned individuals. Thirdly, even if the algorithm receives adequate data, if the algorithm itself is bad, it's also going to make bad predictions. So for instance, a bad algorithm may identify a pattern even when there isn't one, a problem known as overfitting, or it may fail to identify a pattern even when there isn't one, and this is known as underfitting. An algorithm may also give too much or too little weight to certain features or fail to include those features at all. And faulty algorithms can have serious ethical implications. So for instance, an algorithm used widely in US hospitals to determine which patients should get extra care was found to discriminate against Black patients because it used health costs as a proxy for health needs. And because of well-known problems relating to structural inequalities, Black patients often spend less on healthcare than white patients. And as a result, the algorithm falsely concluded that Black patients were healthier than equally sick whiter patients. Or in 2016, the Arkansas Department of Health Services began to use an algorithm to determine how many hours of home care some people with disabilities should receive. And the algorithm caused many people to be hospitalized because it had incorrectly coded conditions such as cerebral palsy and had not accounted for conditions such as diabetes. So it sort of didn't do so well on people with disabilities. Fourthly, as I mentioned earlier, deep learning is a black box that raises questions such as interpretability, explainability, and trust. And deep learning is impenetrable even to its programmers because typically it employs thousands or even millions of connections that interact with one another in very complex ways. So as a result, it's difficult to interpret what these interactions mean. The issue of explainability arises because humans often need to know how a decision is reached. But the deep learning basically just gives us outputs without explaining how, at least in human terms, how it arrives at those predictions. And this could be a problem because suppose an algorithm predicts that there's a 70% chance that Jay's tumor will become malignant in 5 years. Now, the algorithm doesn't, for example, say that there's a 70% chance that Jay's tumor will become malignant in 5 years because Jay has a history of cancer, is over 50 years old, and has lower back pain. Now, without such an explanation, the doctor would be unable to explain to Jay why his tumor is likely to become malignant. And beyond explainability, this also raises the issue of trust in the deep learning system, because we do not know whether it's making its prediction based on reasonable and reliable grounds. And you might think for high-stake decisions in healthcare, not being able to trust the deep learning system is especially problematic. Are there ways to address this deep learning problem, this black box problem? Now, some AI researchers are currently exploring what might be called, or what they have called interpretable machine learning. So one such method involves adding a deep learning model as an additional layer after the hidden layers of nodes and before the output. And this added layer would provide information such as which features were the most important at arriving at a particular prediction, which features could have an even greater impact on the prediction, and so on and so forth. And the hope is that this information would make the deep learning system more interpretable. But there are a number of problems with this approach. So one is that since this is placed outside of the black box, the additional layer is really providing a kind of post hoc explanation of the black box after it has already made its predictions. And so you might wonder whether the black box is giving us the actual reason why a black box gave the predictions that it did. And so this concern can be put in a kind of a form of a dilemma. So either either the predictions are based on those post hoc explanations or they're not. If they're not, then you might ask, well, what's the value of this explanation? It might just be a kind of post hoc explanation that doesn't really correspond to how the black box has arrived at its predictions. But suppose that they're based on the post hoc explanations. If so, presumably you can kind of redesign the AI system just using those post hoc explanations. But if this is the case, this implies that the black box is dispensable. You actually don't need it. And in fact, this may suggest a way to test the value of these interpretable machine learning systems. Now, my guess is that these black boxes are likely to sort of remain indispensable even after you add this layer. And that suggests that the post hoc explanations have not given us all the relevant explanations of why a black box gave the predictions that it did. So other people have said, well, maybe what we should care more about is accuracy rather than interpretability, especially in medicine. So some people have argued that clinicians prescribe medications without fully understanding why these medications work. For instance, aspirin has been prescribed for nearly a century, and some people, we're still trying to figure out how it works. But while we may not fully understand how medications work in many cases, I think we do have some ideas regarding the causal mechanism through which they work. So for instance, some people knew that something from the willow causes fevers and pain to be reduced, even if they did not know about salicylic acid, an active ingredient in the production of aspirin. And this contrasts with machine learning systems, which works through associations and is at least for now unable to track causal relationship. Now, to see why this matters, it is helpful to point out that machine learning is vulnerable to certain kinds of adversarial attacks. So here's one. So these deep learning systems are vulnerable to something called the one pixel attacks. So in one study, researchers were able to get deep learning algorithm to classify an image of a ship as a car just by changing one pixel in an image. And the researchers found that this one pixel attack is successful on nearly 3/4 of standard training images, and that altering even more pixels made this attack even more effective. In another study, researchers made a 0.04% change to the pixel values in an input image. So about 400 pixels out of 1 million. And these changes, as you can see, were imperceptible to the human eye. Nevertheless, the deep neural network classified a panda as a gibbon with a 99.3% confidence. And recently, researchers have shown that adversarial attacks can also be done on medical machine learning. So the fact that deep learning systems are vulnerable to these types of attacks suggests that deep learning systems are not learning the real features of the world, such as causal relations or what a macro level object like a panda really is. Instead, they're just really learning superficially. And for our purpose, if these systems can be tricked in these ways, then issues about explainability and trust remain highly relevant, especially in high stakes domains such as medicine, where human beings could be harmed. So in sum, given all the ways that machine learning could fail, it's critical that companies and AI researchers have an appropriate ethical framework that they can follow when developing these technologies. So let me now say a bit about the fundamental conditions approach. So I'll begin by explaining why human beings have human rights to the fundamental conditions for pursuing a good life. And then I'll also show how this can sort of help us figure out which recommendations are genuine and which aren't. So as I see it, a good life is one spent pursuing basic activities, such as deep personal relationships with one's partner, friends, parents, and children, knowledge of the workings of the world, of oneself, of others, active pleasures such as creative work and play, and passive pleasures such as appreciating beauty, like this lovely room here. And the fundamental conditions approach, the fundamental conditions for pursuing a good life are various goods, capacities, and options that humans, qua human beings need, whatever else they qua individuals might need in order to pursue these basic activities. So for example, the fundamental goods are resources that human beings need in order to sustain themselves corporally. So things like food, water, and air. The fundamental capacities are these powers and abilities that human beings need to pursue the basic activities. So these include the capacity to think, to be able to be motivated by facts, to know things, to choose and act freely. So that's liberty, to appreciate the worth of something, to develop interpersonal relationships, and to have the control of the direction of one's life. So autonomy. And the fundamental options are those social forms and institutions that human beings need in order to exercise these essential capacities to engage in the basic activities. These fundamental conditions for pursuing a good life ground human rights, in my view, because having these fundamental conditions is of fundamental importance to human beings, and because rights can offer powerful protection to those who possess them. So the former claim is true because if anything is of fundamental importance to human beings, then pursuing a characteristically good human life is. It seems clear that if we attach a certain importance to an end, then we should attach this importance to the essential means to this end. So given this, since pursuing a good life is of fundamental importance to human beings, having the fundamental conditions for pursuing a good life must also be of fundamental importance to human beings. That rights can offer powerful protection is well known to those who possess them is well known. By their nature, rights secure the interests of the right holders by requiring others, the duty bearers, to perform certain services for the right holders or not to interfere with the right holders' pursuit of their essential interests. In addition, at least on certain structural accounts of rights, rights typically prevent the right holders' interests that ground rights from being part of a first-order utilitarian calculus. And what this means is that if a right holder has a right to something, then typically no non-right claims can overwrite the right holder's right to that thing. And finally, as some writers have pointed out, because right holders are entitled to these services as a matter of rights, this means that the right holder can simply expect the services without requesting them. So given the strong protection that rights can offer the right holders, and given the importance of having these fundamental conditions to human beings, it seems reasonable that human beings have these rights to the fundamental conditions. So if this is right, this gives us an explanation for why human beings have human rights to the fundamental conditions for pursuing a good life. The fundamental conditions approach can explain why many of the recommendations found in various AI ethics frameworks are genuine ethical principles. For instance, consider autonomy, found in many such frameworks and which requires that patients be fully informed of and understand the risks and benefits of a particular AI health application and that they voluntarily consent to it. The fundamental conditions approach can readily explain and justify this principle. As mentioned earlier, autonomy understood as being able to control the direction of one's life is one of the fundamental conditions. Being able to control one's life in the context of AI healthcare applications, one needs to be informed of and understand the risks and benefits of these applications. And one's use of these technology needs to be voluntary. The fundamental conditions approach therefore implies that patients have a right to have sufficient information and the time to decide whether to use a particular AI health application, and a right to make that decision without being coerced or exploited. Likewise, take non-maleficence, which is also found in many frameworks and seeks to ensure that AI health applications do not impose undue harm on the patients and that any risks are minimized and justified. Again, the fundamental conditions approach can readily explain and justify such a principle. If patients were to experience harm when using a particular AI health application, this would undermine their ability to pursue the basic activities. The fundamental conditions approach therefore implies that patients have a right not to have such harm imposed on them unnecessarily, which means that AI researchers should do whatever they can to minimize risks of harm to patients. At the same time, I think the fundamental conditions approach would also exclude some of the recommendations as genuine ethical principles. So to give an example, take value alignment, which again says that highly autonomous AI systems should be designed so that their goals and behaviors are aligned with human values. Now, many people endorse this recommendation because they're concerned that AI is going to take over the world and they're going to outpace humans, and they want to ensure that algorithms are designed in such a way that they will not harm humanity. But while this is a laudable goal, it's not clear that AI systems should be designed so that their goals and behaviors align with human values, given that human values vary quite widely and only some of them are good. So indeed, while many people would regard Mother Teresa as a moral exemplar, there are others who would not, and would instead regard autocratic dictators and racists as moral exemplars. Now, needless to say, AI systems should not be designed so that their goals and behaviors are aligned with the values of those who prefer autocrats or racists. I think there's a more plausible principle in the vicinity, and that is that AI systems should be designed so that their goals and behaviors respect persons or humanity as ends in themselves. Now, if that were the principle, the fundamental conditions approach can explain why this would be a genuine ethical principle on the ground that having our moral status as persons respected is a fundamental condition for pursuing the basic activities. Indeed, if our moral status as persons were not respected, then others would be at liberty to use us as mere means to their own end. And if so, we would not have the kind of control over the direction of our lives. In any case, what I hope to have shown is that the fundamental conditions approach can be used to distinguish genuine ethical principles from those that are not. I think the fundamental conditions approach doesn't just give us a substantive ethical framework for determining which recommendations are genuine. As I'm going to try to illustrate, it also offers us a helpful framework for identifying distinct ethical considerations that AI researchers and companies might encounter, and for explaining and justifying those ethical considerations. So just to illustrate, in the healthcare context, there's a spectrum in which healthcare algorithms can be deployed, ranging from sort of inside a human organism to outside of it. So the former might, for example, include a smart pill injected into the body to monitor vital signs, while the latter might involve processing data from an imaging device that detects skin cancer. And the fact that a particular healthcare algorithm will be placed inside a human organism can raise distinct ethical considerations. So here's one consideration. Such an algorithm can directly and negatively impact a human being's basic health. So basic health is the adequate functioning of the various parts of our organism that are needed for the development and exercise of the fundamental capacities, such as, for example, the capacity to think. So for instance, various life processes, respiration, digestion, absorption, metabolism, and so on and so forth, and various organ systems, nervous system, skeletal system, and so on, make up and enable and sustain our fundamental capacities. Now, these parts of our organism must function adequately for us to develop and exercise our fundamental capacities. It should be clear that algorithms that operate inside a human organism can directly and negatively impact our important life processes. Indeed, a smart pill inside our body could deliver the wrong drugs or deliver the right drugs, but at the wrong time, thereby disrupting and possibly damaging our various life processes. So for our purpose, the fundamental conditions approach can explain why basic health is an ethical consideration that we should take seriously. Basic health is something that human beings, qua human beings need, whatever else they qua individuals might need in order to pursue a good life. Indeed, without basic health, human beings would not possess the fundamental capacities, and without possessing the fundamental capacities, human beings will not be able to pursue a good life. So as such, basic health is a fundamental condition for pursuing a good life. And earlier we said that human beings have human rights to the fundamental conditions for pursuing a good life. So it follows that human beings have a right to basic health. So the fundamental conditions approach tells us to take basic health seriously because it's a human right. That human beings have this right means that they have a right not to be exposed to undue risk of something such as a healthcare algorithm that can negatively impact their basic health. Here's another consideration. To get healthcare algorithms to operate inside a human organism, we would need to put them inside somebody's body. But bodily integrity is also a fundamental condition for pursuing a good life, because without control over one's body, a human being would not be able to pursue a good life. Hence, on the fundamental conditions approach, we also have a human right to bodily integrity. So the fundamental conditions approach offers another reason why we should be more cautious when deploying healthcare algorithms inside a human body, namely because there is a potential to undermine somebody's right to bodily integrity. To give another example of how the fundamental conditions approach can help identify distinct ethical considerations that AI researchers in healthcare might encounter, there's another spectrum of in which healthcare algorithms can be deployed, ranging from those designed to assist human beings with their decision-making to those capable of making decisions on their own. So an example of the former might be algorithms that can recommend potential medical diagnosis. Physicians can then elect to incorporate these algorithmic diagnoses into their decisions about how to treat patients. And an example of the latter might be a robot surgeon designed to make incisions and perform surgery without any human input or control. With respect to healthcare algorithms that enhance but do not replace human decision-making, we remain in control of how they're used. And this means that we can choose not to use these algorithms if doing so, if they happen not to be aligned with our preferences, or if we believe that they could cause harm and violate the rights of others. However, with respect to algorithms that make their own decisions independently, we may no longer be fully in control of them once they're deployed. Among other things, this can result in the algorithms inadvertently going against our preferences or values and exposing others to harm without our being able to stop them. The fundamental conditions approach implies that algorithms that operate autonomously would require distinct scrutiny, since they could inadvertently subject others to harm and violate the rights of others without our input. Now, so interestingly, healthcare algorithms could be deployed on both spectrums at the same time, resulting in at least 4 types of combined algorithms. So in type 1, you got algorithms that operate inside a human organism and make its own decision. In type 2, you have an algorithm that operates outside a human organism, but it makes its own decisions. And in type 3, you got an algorithm that is inside a human organism, but it's only an input into human decision-making. And in type 4, you have an algorithm that operates outside of a human organism, and it's only just an input into human decision-making. And some examples of type 1 might include next generation brain-computer interfaces, so BCIs, or smart pills, both of which would operate inside a human organism and be able to make independent decisions without human input. Some examples of type 2 might include next generation robotic surgeons or robot caretakers, both of which would operate outside a human organism, but could make decisions on their own without human input. An example of type 3 might be AI-powered in vivo biosensors that can continuously monitor biological processes inside a human organism and providing this information to physicians for further analysis. An example of type 4 might be AI-enabled radiology assistance, which can improve diagnostic accuracy. Now, for our purpose, the fundamental conditions approach can help us see that the ethical considerations we have identified earlier could remain even when the algorithms are deployed on both spectrums. So to give an example, take a next generation BCI, so brain-computer interface, that would operate inside a human organism and be able to make independent decisions without human input. So the fundamental conditions approach tells us that we should make sure that such a device would not violate our right to basic health and our right to bodily integrity, and also that it should not inadvertently cause harm to others. So now I'm going to show that being able to identify the kinds of ethical considerations that one might encounter with respect to a particular healthcare algorithm can help us decide how it should be deployed and implemented. As we have seen, a pressing problem with current iterations of deep learning systems is that their learning is in some sense superficial. That is, they do not learn about the real features of the world, such as causal relationships or this, macro level objects such as pandas. As such, deep learning is prone to getting things seriously wrong, as it's vulnerable to things like adversarial attacks. So what can we do to reduce the risk of algorithms going astray in the healthcare research context? Well, there are at least two options. The first option is to hold the algorithms fixed so that they would give the same results whenever they are provided with the same inputs, or as the FDA puts it, to use something called locked algorithms. By way of contrast, there's something called adaptive algorithms, which are able to learn continuously, and which means that for a given set of inputs, the outputs may change as the learning process is updated. A second option is to hold the environment in which the algorithms operate is fixed and allow for the use of adaptive algorithms. So for instance, consider the next generation robotic surgeons. Suppose that we would like to use adaptive algorithms in such robotic surgeons. We may be able to reduce the risk of the algorithms going astray by holding the environments in which they operate fixed. So we might be able to do this, for example, by allowing a robotic surgeon only to perform tasks that it can do with a high degree of accuracy, such as incisions or suturing. In many healthcare applications, however, it may be difficult to hold fixed the environment in which algorithms operate, since many such applications involve the human organism, the life processes of which are in constant flux, and therefore difficult to hold fixed. So given this, it seems that the first option, locking the algorithms itself, may be preferable to for many types of healthcare research, at least in the near term, and healthcare applications as well. Earlier, we identified 4 types of algorithms. So again, type 1 involves algorithms inside I won't repeat these. Based on the ethical considerations that we have identified using the fundamental conditions approach, it seems that there are good reasons to use locked algorithms, at least with respect to type 1 to 3. So for example, suppose that a healthcare algorithm would be operating inside a human organism and be making its own decisions. To ensure that basic health and bodily integrity of patients remain uncompromised and that they're not inadvertently harmed, it seems that other things being equal, there's a good reason to use algorithms that provide the same output whenever they're giving the same input, so i.e. locked algorithms. Likewise, there's a prima facie reason to use locked algorithms in cases where the algorithms are operating outside of a human organism, but the algorithm would be making decisions on its own, since they could go against our, such algorithms could go against our preferences and values or cause harm without our being able to stop them. Similarly, in cases in which the algorithms would simply assist human decision-making, but would do so inside the human organism, there's also a prima facie reason to use locked algorithms, since they could affect the patient's basic health and bodily integrity. Now, as far as I can tell, the ethical considerations that I identified earlier do not seem to apply to type 4, which serves as, which says that, which serves basically as mere inputs into human decision-making and operate outside of the human organism. Now, this, of course, does not mean that there are not other ethical considerations that apply to type 4 algorithms. However, even though we should use only locked algorithms in type 1 to type 3 cases, we may still be able to take advantage of adaptive algorithms through what might be called staggered learning. So staggered learning involves allowing adaptive algorithms to learn and generate new input-output relations, but not apply that new learning synchronously. So once the new connections between inputs and outputs have been verified and validated, maybe through something like randomized control trials, they could then be used to develop a new updated locked algorithm. So in this way, learning could still occur, but it would be done in steps. Okay, so I'm gonna wrap up. So countless private companies, governmental agencies, academic institutions have proposed ethical frameworks for AI, but they neither explain how recommendations in their frameworks are justified, nor the means by which we might distinguish genuine ethical principles and those that are not genuine ethical principles. In this talk, I argue that the fundamental conditions approach to human rights gives us a more unified and substantive AI ethics framework that can help us address these issues. In addition, I propose that the fundamental conditions approach offers a helpful framework for identifying distinct ethical considerations that companies and AI researchers in healthcare might encounter, and for explaining and justifying those ethical considerations. For instance, I showed that the fundamental conditions approach helps us see that healthcare algorithms that operate inside the human organism could raise issues about basic health and bodily integrity. And that healthcare algorithms that make decisions on its own without human input could raise concerns that such algorithms could harm others without our being able to stop them. Since current iterations of deep learning learn superficially, I also propose that the fundamental conditions approach implies that many healthcare algorithms should be locked, at least for now, but that we can still take advantage of adaptive algorithms through staggered learning. So I think the fundamental conditions approach offers a novel and substantive ethical framework for AI and healthcare, and deserves to be investigated further in further discussions on this topic. Thank you very much. Great. Yes. Yep. Yes. Mm-hmm.
Thank you for that intriguing introduction to your approach of fundamental conditions. I have a related question. I think it's fascinating that you point out that there's many approaches to trying to regulate AI technology that have resulted in statements by industry and societies. But I also noticed that we have those kinds of codes of ethics and credos from companies around technology in general, and there are a lot of them. So it comes to me to think, if you propose this fundamental conditions approach as the substantive foundation, why wouldn't a principlist approach from bioethics, which has served for many years as the foundation, substantive foundation for evaluating those same ethics conditions or codes, why wouldn't that principlist still hold in the AI realm, and why a new approach is needed?
Thank you. That's a great question. So the question is, so as people in this room know, there's sort of the 4 principles approach from biomedical research. And the question is, why couldn't we just use that? And why do we need something new? And that's a great question. So there's a huge debate in bioethics about about principlism, basically. And one of the critiques of principlism is that it's not clear, like they're mid-level principles, but it's not clear how they're unified. It's not clear what happens when they conflict. So for example, if you have autonomy and beneficence, if they conflict, how you should adjudicate between the two. It's not clear what comes out of it. So take autonomy, what exactly do you get from a principle of autonomy? There are sort of different conceptions of autonomy and so on and so forth. Now, of course, there's a huge literature on this, as you very well know. But I think even in the biomedical healthcare sort of context, there are other people who have sort of try to defend more substantive approaches than principalism. So principles, there's a worry that these principles, they're sort of there, they seem right, but they don't hang together. And like, so there are other people. If you think of like Clausen, for example, has like some work that tries to explain it in terms of harm, try to unify it a bit further. I think the human rights approach is another way in that context where I've argued, that's what I've done, sort of argue elsewhere that this framework could be better suited in that context as well. And so, but it's a broader debate. And what's missing? So I think what's missing is sort of a story about why these things matter, right? Like, why do we care about autonomy? Why do we care about beneficence, and so on and so forth? And what the human rights approach tells you is that ultimately it's about human beings and their flourishing, right? And so it's sort of like what we care about is human beings being able to do things, pursue basic activities, and so on and so forth. And if that's what we care about, there are a bunch of things that we should make sure that they have. So that, in some ways, it provides that further explanation that the principalism doesn't try to answer. Let me just say on principalism's behalf, it sees that as an advantage, right? By not coming down and saying, hey, this is what human beings, like we care about human flourishing and their pursuit of basic activities, et cetera, et cetera. It stays away from more substantive, commitments. It sort of says, look, we can all agree about autonomy, whatever else we might think is important, and so on and so forth. But my view, and I'm happy to discuss this further, is that we can't avoid going more substantive in these inquiries. And so, yeah.
I would like to push back from the side of AI a little bit with regard to the claim that deep learning is simplified or superficial.
Mhm.
Everybody in the computer science department knows.
Oh,
Everybody in the computer science department knows that, and they're attempting to address that issue because their move is to try to become more autonomous. So what seems to be needed is some kind of approach to teach them more about what the ethical issues are while they're still at the stage of developing the algorithms, before the algorithms get developed, because they are interested in the success of the algorithm.
I think what you're saying is there's a big attempt to try to teach ethics to sort of people who working, like the computer science departments are very interested in ethics, and there's and I think that's right. I'm actually at NYU. We've been working with people in the computer science department to try to develop a course on computer ethics. So the interest is definitely there. So it's not it's the comment there isn't sort of the AI researchers don't care about ethics. The comment, what I say there is that fundamentally machine learning and deep learning right now learn superficially. So they basically use a bunch of data, and they just, some people call it curve fitting. They're just trying to fit curves there, and so on and so forth. But the curve fitting is very superficial. It doesn't really understand what's going on. And the adversarial attacks really bears this out. So for example, you take like self-driving cars is another example. You can put a banana sticker on a stop sign, and all of a sudden the algorithm cannot recognize a stop sign. So humans can easily say, oh, that's a stop sign with a banana sticker on it. But the algorithms can't. And so that just shows that there's something that the algorithms are really missing. Thank you all. Thanks.